And Ohad made an interesting comment about identifying children who go below the radar. And I'll ask you to consider, we won't talk about it today, maybe another day, does one require a diagnosis to have a problem? That the children who are identified by the Moxo performance clearly have a problem, and yet the thresholds for the teacher's observations don't behaviorally identify that. So it creates an interesting conundrum about trying to help children be the best they can be, function the best they can function, even if in fact they don't have a diagnosis. And that's what's exciting about what we're doing at Neurotech and what we're doing with programs like Moxo in helping all children harness effective and efficient strategies to solve problems and to attend to tasks. ADHD as a diagnosis involves two criteria: inattention and hyperactivity impulsivity. I say two because in factor analytic studies, hyperactivity and impulsivity are predictive of each other. So ADHD is a two-factor disorder with three sets of symptoms, and that's what you see there in that slide. So what is attention? Again, it's a debatable issue. When I was an animal researcher, before I decided I liked children better than rats, for me and my animals, attention was what the animal was focused upon. When I began working with children, I discovered that often lack of attention as described by a parent and a teacher was really describing lack of compliance. When a rat's not paying attention, it's sleeping. Many of these children, when they were not paying attention, were in fact not complying with the adult's request, but they were paying attention to something. It's a complex process involving multiple parts of the brain, leading to functional deficits and then impairment in all walks of life. And both the DSM, the American version of this ICD, as it were, and the ICD, both require cross-situational impairment. It's not enough to have symptoms. Before 1987, one could diagnose ADHD absent impairment, but now you cannot. You have to have impairment in problems. And so ADHD is a biopsychosocial problem. The outcome is impairment in functioning. Relationship between EF and ADHD. ADHD is a diagnosis. Executive functioning is a process based on a set of processes. ADHD is defined by behavior. EF is defined by these processes, how you do these things. ADHD is a summary term for a group of symptoms. EF is a summary term for a group of processes. ADHD may include some EF processes like planning. EF may include some ADHD symptoms like paying attention. Tests for ADHD and EF do not correlate very well with behavioral measures of these conditions, meaning Moxo test, as you heard today, may identify children that teachers don't identify. The correlation between behavioral tests and observational measures are not exactly identical. ADHD is defined by a research consensus. EF at this moment has no such consensus. ADHD is clearly not executive function deficit disorder.